the amount of sugar in ketchup is shockingly high. And I really think that there should be a lot of knowledge that's disseminated to the public on sugar, because I think that's the one single biggest vice that people can ever consume. So I really hope that there is like a definitive study on what is good, what is not, and I really hope there are no flip-flops. There should be something worldwide, and ingredients or products that incorporate way too much sugar than what is really acceptable to the human body should definitely be banned. Thank you very much.
Thank you, Aruna. Good morning, everyone. A big thank you to you, sir, Ms. Preeta Reddy, and Dr. Srinidhi Chidambaram for having me over here with distinguished panelists. Healthy lifestyle. Absence of disease is not wellness. That is the first mindset which we all have to change. Because when we talk to people and they say, when I see patients for therapy, they say, I'm fine, madam. I don't have BP, I don't have sugar. But what they don't see is they have loads of stress. So to me, wellness means, a healthy lifestyle means when the body, the mind, and the spirit are in harmony, are in integrity. Most often we see that people think something, they say something, and they do something totally different. So that's where the confusion starts. That's where there is a lot of blockage starts. And that's how it manifests into the body, according to the yogic philosophy. So I feel if we start bringing in some kind of truth to our own selves, in our thoughts, in our actions, and our speech, we will go a long way to actually, come out of this disease.
Thank you. But all this is very well. We all know, I think all of us know that we have to exercise, we have to eat right, we have to meditate, do yoga, de-stress. But the truth is, as you yourself said, the truth is sometimes very different, where we always have this, especially women, we say that we don't have time, we have work, we have family, we have 100 other things to do, which is always coming before taking care of this and sparing some time for making sure that we do all these things that we read and talk and learn so much. But you are all women who are busier than most, but I think you all have that discipline and you have all maintained yourself well, and I think we would like to hear from you, how do you do it? What do you practically do to ensure that you do have a daily lifestyle? So,
Not? Yeah. Okay. Yeah, sure. Okay, so we have to prioritize, because I believe that if I am not happy, I am not healthy, I can't make my family happy or healthy. And in turn, I can't do a good job, I can't contribute to the society as an individual. So what can be termed as selfish by most of the people is actually, there's a word for it, it's called sacred selfishness. It's self-care. So once I look after myself, so I have to dedicate a certain amount of time for the day where I eat healthy, I think healthy, it's my time. I'm not lonely, I'm alone. So that is a time if I give myself, I can actually look after myself, because the body is the only capital we have. We cannot buy it. We only have to preserve it. And we jolly well do that because that's the only place where we got to live.
Especially people like Valli Akka or Srimati Sudha, they also travel a lot and you're like all the time performing and you have to keep up with rehearsals and all sorts of things. So how do you keep up this routine of keeping yourself fit? We'd like to know from you.
Facing all these illustrious doctors and everyone who's into this health style, and being a dancer, I feel I'm obliged to say something very profound about keeping myself fit. But actually my dance does it for me, where it comes, because the whole discipline of dancing every day, and I have to practice for hours every morning, so that the very basis, the foundation is laid in that. But speaking of traveling abroad, I must confess that we do not have time. We sometimes average 3 and 4 hours of sleep a night, so I can't claim to, particularly when I travel, lead a very healthy lifestyle, because the demands are so great. But I do think what Sudha said is very true, is that I tend to listen. I have grown into the habit of listening to every little twinge or creak in my body, and there are many of those these days. And I find that it certainly helps. There are some things that may creep upon us unawares, but being sensitive to the body and paying attention, and that's where I think, because we don't prioritize, because we don't decide, are we really achieving something or is this important to us, we don't have time to pay attention to these things. So I really think it is a matter of deciding for your body and for what you think is important, what you think, and designing something to suit you, and then keeping to that discipline. In my case, it is my morning practice, or through the day I have to have it. I was a very scrawny, thin child, and we had Dr. Ratnavelu Subramaniam in the family, and people said I should stop dancing because I was so thin. And in fact, he said that it's only because of your dance, you'll have to continue. So I think my wellness has a lot to do with dancing and with following that discipline.
So I'd like to just add and say that in my day, I mean, many people here are far busier than me. I was able to run a business in India actually because I was in a city where Apollo hospitals existed. All the foreign direct investors that came, Dr. Reddy, Ford being the first one, the 80 families would not have chosen Chennai in Maramalai Nagar unless they could see Apollo Hospitals was here. So in our lifetime, it's been busy with a lot of expats coming into India. And me as a person, I'm a pretty traditional homemaker kind of material because I've not really studied too much. I've worked around the world a little bit, and I've been an accidental entrepreneur that helps foreigners understand Indian culture. But the art that I think I have tuned quite well is what I call quiet assertiveness. As a woman in India, we have to learn to be able to say no sometimes, which we find it very hard to do. We find it hard to say no to family functions. We find it hard to say no to so many social engagements. We find it hard to say no to ourselves when we have to be involved in too many things. So by creating little pockets of no time, I think I have created pockets of me time. And that's what I would encourage all women to try to do. It helps.
Madhu, what about you?
I think, Ranjini, you hit the nail on the head. It's so difficult to say no, and no one wants to take a no, first of all. So it's always a yes or a half yes, and that lands you in a situation where you find so little time for yourself. But to answer Srinidhi's question, I believe that each one of us should design a regime for ourselves. I don't attach myself to a gym because when I travel, I get lost and probably put on oodles of weight because there's no gym suddenly. And hence, what I do is yoga and meditation. And that helps in a very, very big way. Just sitting still, just meditating, looking at your breath. I mean what I say, looking at your breath as you inhale and exhale inwards really helps you to calm the mind, keep the body still, and re-energize you for the next activity. Of course, diet is very important. Luckily, I don't drink coffee, tea, nor do I take sweets. So that alleviates a lot of suffering for me. And the fact that I eat a lot of nuts and green vegetables, fruits, drink a lot of water, all of that combined with the little bit of exercise, physical exercise that I do at home, and the meditation, of course the singing, this entire package helps me and keeps me going, I guess.
As far as I'm concerned, I have three things. One is my dancing, but I don't, to be very honest, I don't rehearse every day like Valli auntie does. Nobody can, trust me. But nobody can. I think Srinidhi and I will completely agree from the entire dancing world that nobody can stay as fit and as vibrant as she has been for so many years. We've all looked up to her as dancers, and some of us even entered the field thanks to her. So that is difficult, but I do exercise. The one thing that I have started doing now to kind of spend this little me time is switch off my mobile data on the phone. So I stopped WhatsApping, Facebooking, Twittering, Instagramming, and Messengering. These have become words as part of our dictionary now. You know? You don't talk about cycling, walking, as much as you're WhatsApping and Facebooking. So probably 30 to 35 minutes of your day, if you can spare from all these vices, I would say, you have the wise time to basically spend on exercise, or just sit and breathe. Sit, chapla kaal potundu, just sit back and do nothing. It is very difficult for women like us, but that's wonderful. I can't give up my sweets. When I go to a wedding, I have to sit in a pandi and eat. I cannot give it up. But yes, on a regular day, I have given up all the whites from my life. So, pardoning you, sir, that's not what I meant. I meant the milk, the sugar, the ghee, and all of that from my life. So, that has helped me. And yes, when I walk into school, when I see those children, when I keep interacting with that age, most of the time of my life, like you said, Aruna, your society, your ambience, your environment around you helps you keep healthy. And for me, I'm lucky I have youngsters all around me, whether it is my school or my theatre company. It's a lot of young people around, so I feel young all the time. So that's my work.
Just to add to that, I think for the larger audience here, it's always difficult to find that me time. But I think what we need to do is marry your lifestyle into being one of healthy. Like you climb more stairs, don't use the lift. You know, you can do a lot of little things like that is incorporated, and that does not really need to go to a gym or, you know, or of course yoga is good, meditation and yoga. But beyond that, if you're eating healthy every day, I don't think we need to add that addendum healthy lifestyle. Our lifestyle should be that. And if you're not following that, it's a bad lifestyle. So it should be something like you sleep, you live normally and healthy. So which means that you incorporate in every step of your life. See, this is about choices. Sometimes you're not able to go out because you have to go and pick up a child. You're going to miss your class. But then if you keep fretting about that choice that you have made, you have actually defeated the purpose of even going for that exercise. So therefore, stay positive and try and do everything physically like our parents and our grandparents did. I think that would be sufficient. We really don't need to fret about missing our exercises or eating that extra, indulging in that extra sweet, as long as we live a lifestyle that is complete. That's my take on this.
Srimati Sudha, I'd just like to ask you this. We come from a culture where music is not just seen as entertainment, and we see it as a prayer, as something which is deeply spiritual. And we also have seen that music can be very relaxing. When we come out of your concerts, we have a deep sense of relaxation. There's also a little bit of talk that, you know, music itself is a healer. There is talk of music therapy and so on. Have you delved into that aspect of your music, or is there any research that has been done? Because we need all the tools that we have in our armament to fight stress. So is there some role for music to play in that?
Definitely, music helps to heal people and is a stress buster. Being a classical musician, I would only speak from this perspective. Definitely, music and the ragas that we sing, the particular ragas, can be of therapeutic value to people. We have read about how music helps patients who are undergoing chemotherapy to bring down the pain, to bring down the suffering. Maybe it cannot cure cancer, but definitely you can think of it as an alternative, out-of-the-box facility to use. Music, when listened to in the right dosage, stimulates brain waves. And hence, when you listen to music that is fast and which vibrates and reverberates, you kind of become active and alert. And when you listen to music that is more soothing and calming, your mind automatically responds to it, and the body becomes more relaxed, more calm, less stressful. And hence, I believe that many office goers listen to music as they travel to their workplace. They even listen to it when they're working. You know, it's like a very low volume music. And I can definitely say that it helps students as well. Because my son used to do his math, used to do his lab projects, used to do his physics lab work and practical drawings, listening to music. And I would also say, how could you do two things at a time, listen to music and do your homework? But he used to say that music helped him work with more energy and work faster, made him less fatigued, less sleepy, or less irritant. And I can definitely vouch for that. Maybe I should sing small bits of a few ragas that could calm the mind. I am doing a bit of project work with these ragas, like insomniacs. You know, we think of certain ragas that can be played by their bedside. And as they listen to it, they fall asleep. There are ragas like Kapi, Neelambari, and ragas like Ananda Bhairavi, Riti Gaula, Ahir Bhairavi. All of these help patients who are suffering from hypertension, depression, anything to do with the mind. Asato ma sadgamaya tamaso ma jyotirgamaya mrityorma amritam gamaya. Shanti. Ulagile shanti nilava vendum, Atma Shakti onga vendum.